and welcome to Insulation Matters, the podcast where we shine a light on the tools and technology that keep modern surgery safe. I'm your host, Anajeriee, a surgical technology student with a passion for patient safety and process improvement. Today, we're going deep, no pun intended, into the world of laparoscopy, a minimally invasive technique that has revolutionized surgery. But we're not just talking about what it is. We're digging into a hidden issue, insulation failure in laparoscopic instruments, how it causes serious patient harm, increases costs, and what sterile processing departments like ours do to improve it. Let's start with a quick refresher on laparoscopy. Laparoscopic surgery, also known as minimally invasive surgery, involves making several small incisions instead of one large one. A thin, lighted tube with a camera called a laparoscope is inserted into the body. Through the other incisions, surgeons use long, narrow instruments to perform the procedure. This method is used in a wide range of surgeries: gallbladder removal, appendectomy, hernia repairs, gynecological procedures, colon resections, and even some cancer surgeries. And there are big advantages. Patients usually experience smaller scars, less pain, lower risk of infection, shorter hospital stays, and faster recovery. It's one of the greatest advances in modern surgery. But it also depends heavily on electrosurgical instruments, tools that use a high-frequency electrical current to cut tissue and cauterize bleeding vessels. These tools are covered in an insulation that keeps the electricity flowing where it's supposed to go, only to the surgical site. Now here's the problem. Over time, repeated cleaning, handling, and sterilization can cause tiny cracks or pinholes in the insulation covering those laparoscopic instruments. Sometimes it's from harsh chemicals, rough handling, or wear and tear that comes with daily use. These small defects allow stray electrical current to leak out during surgery. That stray current can burn or damage nearby tissue without the surgeon even knowing it. These burns are often not visible through the laparoscope and may not be discovered until hours or days later, when the patient starts experiencing symptoms like abdominal pain, fever, or organ failure. Some insulation failures lead to complications such as bowel perforation, internal bleeding, sepsis, additional surgeries, and sadly, death. In fact, according to a study in Surgical Endoscopy, up to 20% of laparoscopic instruments in circulation have some form of insulation defect. Even worse, many of these defects are invisible to the naked eye. Another study found that 67% of stray energy burns go undetected during surgery. That means patients are being injured without anyone knowing it. And hospitals may not connect those injuries to equipment failure until it's too late. And here's the most alarming part. 1 in 4 patients who suffer a stray energy burn from an insulation failure die as a result. That's a 25% fatality rate for a problem that is completely preventable. So why should hospitals care? First, patient safety should always be the top priority. But even if you only look at the numbers, the cost is staggering. Let's take just one example. A large hospital in the Midwest reported spending more than $500,000 per year on repairing and replacing damaged laparoscopic instruments. That doesn't even include the cost of complications from burns, which can lead to prolonged ICU stays, emergency reoperations, malpractice lawsuits, loss of reputation, and penalties from the insurance providers and CMS for surgical complications. Now, let's look at disposable versus reusable instruments. Disposable laparoscopic instruments are supposed to eliminate the risk of installation failure, but they come at a steep cost, 9 to 19 times more expensive per procedure. So, while disposables reduce some risk, they are not a financially sustainable solution for every hospital. Reusable instruments are still widely used, but if we don't maintain them correctly and test them regularly, we're just passing the problem down the line. Now, let's talk solutions, because this is where the Sterile Processing Department, or SPD, becomes absolutely essential. Solution 1. Routine insulation testing. SPDs should use insulation integrity testers, like the McGinn insulation tester, to check every reusable laparoscopic instrument before it's used. These handheld devices allow you to detect cracks, pinholes, and other defects quickly and accurately. In less than 30 seconds, a technician can scan an instrument and determine if it's safe for use. This one step alone can eliminate most insulation-related burns. Solution 2. Visual inspection under magnification. All insulated instruments should be inspected under lighted magnification as part of a routine quality control. Even if an instrument looks intact, SPD techs need to be trained to look for the signs of damage, discoloration, peeling, dents, or soft spots that could indicate insulation wear. Solution 3. Active electrode monitoring, or AEM. Some hospitals go a step further by using active electrode monitoring systems in the OR. These systems detect and prevent stray energy from escaping during surgery. In one clinical study, the use of AEM devices reduced burn injuries to 0. That's a massive improvement, and it proves the technology works. Solution number 4. Documentation and tracking. Failed instruments should be logged into tracking systems, so trends can be identified. If a particular instrument or vendor produces repeated installation failures, that information should be shared with purchasing and clinical engineering departments. Solution 5. Education and training. Sterile processing techs and OR staff must be trained regularly on installation integrity, but how to test for it, and what to do when a defect is found. Following AORN and AAMI ST79 guidelines ensures that best practices are being followed across the board. We're not alone in this mission. Professional organizations like AORN, the Association of Perioperative Registered Nurses, have clear guidelines stating that all insulated instruments should be tested for integrity before each use. AAMI's ST79 standard also supports routine inspection and preventative maintenance. But these recommendations only work when hospitals put them into practice. And that starts with well-trained SPD techs like us who understand the risks and know how to respond. SPD staff should be trained to recognize damaged coatings, know when to remove items from circulation, and have the confidence to speak up when something doesn't look or feel right. So here's what we've learned. Laparoscopy is powerful, but it comes with hidden risks if equipment isn't properly maintained. Installation failure is common, dangerous, and often invisible. SPD techs are the front line of defense. By using the right testing tools and inspection methods, we can stop burns before they happen. Hospitals can save lives and money by investing in preventative systems and cross-department communication. Here's what you can do next. If you work in or around sterile processing, ask if your facility uses insulation testers. If they don't, advocate for it. If they do, make sure you're trained and confident in using them. You might just prevent a tragedy. So what can we, as sterile processing technicians, do with this information? Here are your key takeaways. Always inspect laparoscopic instruments before sterilization and after cleaning. Don't assume they're fine just because they've passed visual inspection last time. Use an insulation tester. This is one of the easiest and most cost-effective ways to catch dangerous defects before they reach the OR. Document all failures. Tracking and trending these issues helps SPD lead the way in preventing surgical complications. Communicate with the OR. If an instrument fails inspection, notify the circulating nurse or clinical coordinator. Your voice matters. Advocate for training and technology. If your facility doesn't have insulation testers, speak up. A $1,000 piece of equipment could prevent a multi-million-dollar lawsuit or save a life. Patient safety doesn't start in the OR. It starts in SPD. We are the first and last line of defense before those instruments touch a patient. Thanks for tuning in to Insulation Matters. I'm Anajeriee, and I hope today's episode inspires you to take a second look at the tools we clean and prep every day, because the safety of every surgical patient depends on it. If you found this episode helpful, please like, comment, or share it, and don't forget to check out the show notes for full citations and resources. Stay safe, stay sharp, and I'll see you in the next one.